Hello, we are Group 1 and we are presenting a video to spread awareness of what healthcare workers do and their roles in the medical field. We hope that you learn something from our video and that it may help you to further understand on what they do. I hope you enjoy and God bless.
Hi there, I am a rehab med and we enhance and restore functional ability and quality of life to people with physical impairments or disability. This can include conditions such as spinal cord injuries, brain injuries, strokes, as well as pain or disability due to muscle, ligament, or nerve damage. We doctors are experts in minimizing and preventing disability.
Good day. I am a nutritionist dietitian, and it is my job to help you with regard to food and nutrition. I will assess your nutritional status and problems and develop a diet plan that is specific to your condition. I can also offer counsel and give advice that promotes healthy eating habits in order to prevent and treat illness. How? By educating you about general nutrition and health properties in food. However, my services are not limited to the clinical setting. I can also offer my knowledge and my expertise in the food service setting by managing and distributing high quality and nutritious meals. I can also formulate strategies for the prevention and treatment of nutrition related diseases in the community setting. As long as it is food related, nutrition related, then you are at the right person. Again, I am a nutritionist dietitian.
This is a miniature version of a prosthetic socket for the leg, which is where leg amputees insert their leg in when putting on a leg prosthesis. Hello, I am a professional prosthetist. My job is to provide amputees with artificial substitutes for missing parts of the body, especially as seen in this case, the limbs or the lower limbs. These artificial substitutes are what we call prosthetics, as seen in the title of my profession. This is not just limited to the lower limb as we see here, but can also include the hands, arms, feet, and other structures of the leg. Living without certain parts of your body can be a very hard life. My job is to ease in the lives of these people by giving them different kinds of prosthetic attachments to make them feel whole and complete again. A prosthetic that saves an amputee's future, and that is the role I am willing to play with my profession.
Hi, I'm an obstetrician gynecologist. Hence its name is a combination of obstetrics, which is a field of study that focuses on childbirth, pregnancy, and postpartum period, and gynecology, which focuses on the overall health of the reproductive system of a female. It is my responsibility to take care of new mothers, explain to them the birthing process, and provide them with delivery and postpartum care. I also treat and diagnose female-specific diseases such as some forms of cancer and menopause.
Good morning, I'm your nurse for today and I'm here to get your temperature checked and monitor you if you're doing better. So your temperature is 36.4, that's good. Just don't forget with your medications after your meals. I would come back here and prepare them all for you, okay? And then later on, the doctor would also come by and check for your recovery if you're doing it. Sounds great? So if you need any assistance, just feel free to ask for it, okay? As nurses like us are responsible for monitoring your health, administering your medications, conducting your physical exam, and of course, planning for your care. Our main role here is to provide the support and assistance in any way possible.
I am an occupational therapist, and I treat people of all ages with disability, health conditions, or diseases that mainly affect their ability to perform functional and daily activities. Our field utilizes the therapeutic use of occupations in order to facilitate the capability of our patients in performing with the highest degree of independence possible. Again, I am an occupational therapist and I help people in regaining their normal bodily functions in order to go back on performing day-to-day activities.
Oh hi! Didn't see you there. Are you perhaps having trouble in breathing? Well, you're in luck. I'm a pulmonologist. We specialize in diagnosis and treatment on respiratory system, not particularly affects your breathing capability. Our role on this pandemic is to monitor respiratory effects, most notably engaging patients who are critically need in the ICU and providing necessary information to the patient's family. But as a doctor, as many doctors, telling their patient prevention is better than cure. We insist to our clients to stay away or to limit the activities that might harm their lungs. Once again, I'm your pulmonologist, happy to serve.
Hi, I'm a cardiologist. My prime goal is to treat diseases in the cardiovascular system. Diseases such as arrhythmia, cardiomyopathy, and congenital heart disease, just to name a few. We formulate diagnoses by conducting an array of tests or by simply using the electrocardiogram so that we can keep your heart up and running. And as we all know, our cardiovascular system is closely tied to our respiratory system, which is why we play a crucial role in these trying times of COVID. All things considered, we cardiologists are here to provide care for patients with ailments that concern the heart, the blood, and the blood vessels.
As a social worker, my primary responsibility is to help people improve their outcomes of life. I try maintaining professional relationships and act as an advocate and guide in order to support an individual or families through difficult times. I ensure that services are being received by people, may it be social, environmental, emotional, financial, and support needs before and after their discharge.
Mental health is an overlooked but important part of our overall well-being and function. I am a psychologist, and this is the aspect of healthcare we specialize in. Through studies of human behavior, we aim to improve quality of life for patients by helping them understand various psychological or behavioral problems with the aim of helping them cope and manage the struggles these problems might otherwise pose on them. We help turn our patients' seemingly abstract or hard to comprehend difficulties to ones they can manage to grasp and use to take charge of their life.
Hello, so I am your radiologic technologist and I perform your x-rays, your CT scans, your MRIs, your ultrasounds, and many other tools for diagnostic imagery for your internal organs, your bones, and many other tissues in the body. If you've ever had a fracture, you probably got an x-ray. If you wanted to know if your baby's healthy, then you probably got an ultrasound. Then, you've already met a radiologic technologist. As a radiologic technologist, I am trained to interpret medical images to either diagnose or rule out a disease or an injury. I am responsible for accurately positioning patients and ensuring a quality diagnostic image.
I'm a pediatrician, and we are doctors trained to handle the mental, physical, and behavioral health of the children from birth up until 18 years old. Some of the common things that pediatricians do is number one, we check or monitor the baby as soon as he or she is born in order to ensure that her development will be sustained. And second, we also monitor sick children and give proper diagnosis in order for them to recover. And lastly, we also provide or we also prescribe medications in order for children to avoid such diseases. And so, because babies don't come with owner's manuals the moment they are born, we pediatricians are here to help the parents in making sure that the children's health is being monitored.
I am a neurologist. So to understand what I do, we must first define what neurology is. Neurology is a study that deals with the disorders of the nervous system. So that includes the brain, the spinal cord, and the peripheral nerves, or anything in between. Now what I do is I assess and treat the patient who presents with these disorders. It is important to take note that a neurologist is very different from a neurosurgeon. When these cases are severe, it may need surgical intervention. Now, this is where the neurosurgeons take the case. As a neurologist, We treat the patients non-invasively and non-surgically.
We SLPs are responsible for patient who has communication and swallowing problems. Most especially if a patient is experiencing having difficulties with their speech, which is the ability to speak or express themselves, language, which is the ability to understand what they hear, and swallowing, which is related to our speech structures. Additionally, we partially take part in the hearing of the patient. But take note, we cannot or we do not diagnose hearing results. We can only check for the hearing impairment of our patient relating to the communication ability of the patient.
I am a medical technologist, or also known as laboratory technologist. I analyze biological samples in order to treat or diagnose various diseases. Our main duties include preparing biological samples for testing, conducting blood tests, and writing reports on our findings. Medical technologies are important as they provide accurate and precise data based on the lab results for the doctor to use make conclusions for our patients. Because having an accurate test results can mean the difference between the life and death of a patient. The medical technologists must be aware of when the results are incorrect and must be rechecked always. Again, I am a medical technologist.
I am a respiratory therapist, and it is my job to help patients with cardiopulmonary diseases. Like physical therapy, we make treatment plans for our patients. But where we diverge is that we primarily focus on our patients' respiratory health. It is my job as a respiratory therapist to aid my patients in whatever cardiopulmonary illness is affecting them. We work under the direction of doctors and treat a large range of patients from premature infants to elderly people. Us respiratory therapists are in need in society since we can help people affected by pollution, birth ailments, and problems brought upon by vaping and smoking, just to name a few.
We pharmacists doesn't only provide appropriate medicines for the patient. We also give information regarding drug interactions, side effects, dosage, and proper medication in order to achieve the best clinical outcomes for the patient. With the help of other healthcare professionals, such as physicians, doctors and nurses, pharmacists can help in ensuring that the patient properly take their medications as prescribed and avoid any health complications.
Good day. I'm an orthopedist, and for a little background about what I do, I am a healthcare professional whose specialty is treating and preventing deformities of the skeletal and muscular system. So the patients that we treat are those who experience significant pain, swelling, and deformities related to a joint injury or severe sprain to a muscle, ligament, or other skeletal structure. Since we orthopedists specialize in injuries and conditions related to the musculoskeletal system, it is our responsibility to provide diagnosis, some surgery, and the rehabilitation of the patient. In short, the treatment that we provide focuses on the surgery and the healing process following the surgery, along with the conservative treatments.
Hello, I am a special education teacher who instructs students who have mental, emotional, physical, or learning disabilities. For example, we help students develop study skills such as highlighting text and using flashcards. And we also help students who have sensory disabilities such as visual or hearing impairments. It is my responsibility to assessing children's skills and learning requirements, develop individualized education programs for each student, discuss students' progress with parents, other teachers, counselors, and administrators. Again, I am a special education teacher.
Hi, I am a physical therapist. We physical therapists assist patients with injuries in regaining range of motion, managing pain, and improving their overall quality of life. We play a significant role not only in treating musculoskeletal conditions, but also in educating patients on how to stay fit and avoid future injuries. We examine each individual and then develop a treatment plan to help them move better, minimize or manage their pain, recover their function, and prevent disability. Again, I am a physical therapist.